Welcome to Lancaster General Health Surgical Services. Our team is committed to providing you and your family with compassionate care and understanding. We know this can be a very emotional and uncertain time. You can relax knowing that our team is dedicated to safety and to your child. We have a highly experienced staff, specially trained in pediatric care and certified in pediatric advanced life support. While most children are able to return home the same day as their surgery, we do offer a full-service pediatric department where your child can be cared for if necessary. The virtual tour you're about to see provides you with an overview of Duke Street Day Surgery. We also care for pediatric patients at our orthopedic center, main operating room, and at our suburban outpatient pavilion on Harrisburg Pike. For locations and directions, please visit our website at www.lancastergeneralhealth.org.
You may be wondering what you can do to help your child prepare for a trip to the hospital. We recommend talking to him or her about what to expect. If the date of the procedure is not for a few weeks, it may be best to wait until a few days before coming in to have this discussion. Keep information basic and frame it positively. Sometimes making it into an adventure can help. Your child will take cues on how to respond from you, so remain as relaxed as possible. Please also know that we are here to help you on this journey and welcome your questions and suggest writing them down as they arise. Before your child is scheduled to come to the hospital, one of our nurses from the pre-anesthesia clinic will call you. The nurse will ask questions related to your child's health, including any allergies, medications, previous surgeries and illnesses, as well as some questions related to family history. She'll also give you a few guidelines for the day of the surgery, including making sure your child has nothing to eat after midnight the night before, allowing your child to drink up to 12 ounces of clear fluid early on the day of surgery. Clear liquids include things like apple juice, white grape juice, Sprite or Jell-O. Nothing at all to drink for 2 hours before the surgery. If your child gets sick between now and the day of surgery, you should call the surgeon's office. They can help to evaluate if it would be safest to delay the procedure until another time. To help make your child as comfortable as possible, we encourage you to bring your child's favorite blanket or stuffed animal, which can go with your child into the operating room. Your nurse will also let you know where to park on the day of the surgery. On the day of the procedure, you will enter the parking area. If your procedure is at the suburban outpatient pavilion, you will park in the general parking lot, proceed to the main entrance, and take the elevator to the second floor. For procedures at Lancaster General Hospital, you will be directed to either the Lime Street parking area or the James Street garage. After parking, proceed to the second floor. Bring your parking ticket so we can validate it for you. Your parking will be free. Greeters are available at each facility to welcome you and help you find the registration area. At the registration desk, the secretary will verify the accuracy of the information we have about where you live, the spelling of your child's name, and their birth date. To promote safety, we may ask you to verify this information various times while you are with us. Once your child is registered, you will both go to a room where the secretary will give you some general instructions and ask your child to change into our special pajamas.
Good morning.
The staff in the surgery center will verify your child's information and also get his weight, heart rate, temperature, and possibly blood pressure. The nurse will then review the information you provided earlier about your child, making sure it is correct and up to date. She'll also ask if your child has had anything to eat or drink that day, and if there have been any changes in his health. The nurse will also confirm any allergies and review consent forms that parents or guardians will need to sign. Before surgery, other members of our team will stop by the room to check in on your child. The anesthesia doctor will stop by, which is a good time to ask questions if you have any concerns about anesthesia. He may order medication that would make your child a little sleepy. You may want to hold your child as this medicine begins to work and to help him relax. The nurse who will be with your child in the operating room will also be in to talk with you, to introduce herself, and to see if you have any concerns. The surgeon will come in to answer any questions you might have before surgery and will mark the surgical site with a surgical pen or place a special bracelet on the child's wrist or ankle. Once all the information has been confirmed and the time of surgery has arrived, we will snuggle your child in warm blankets and place him into a red wagon, crib, or bed for the ride back to the operating room. After your child goes back to the operating room, you can go to the waiting center. Please register at the desk and they will give you a beeper so we can easily locate you in the waiting room. The surgeon will be out to speak with you after he is finished. Once your child enters the operating room, he will be asked his name, and the registered nurse and anesthesia provider will check his identification bracelet and have the chart open to the surgical consent while the nurses will put some monitors on him. Once all the monitoring equipment is hooked up, the anesthesia provider will place a fruit or bubblegum flavored mask over your child's nose and mouth, and he will be asked to breathe into the mask. They will explain to your child that he will go to sleep, and when he wakes up, the procedure will be over. The staff from the operating room will talk to the nurse in the recovery room about how your child did during the procedure. When he wakes up in the recovery room, we will call the waiting room so you can be reunited. If your child feels okay, he can have a snack, such as apple juice and graham crackers, or an ice pop. If he has a favorite sippy cup or uses a bottle, you can bring it along. Your child will be asked if he is having any pain. By using a special scale, he can show or tell the nurses how he is feeling. If he is having pain, we will give him something to help him feel better. While your child is sleepy, pain medicine may be given through the IV tube in his hand, which he won't feel. When he is more awake, pain will be treated with a liquid or a pill to swallow. When your child is awake, has had a little snack, and is feeling ready, he will go to the room from which he will be sent home. There he can watch TV and be joined by any other members of your immediate family who are waiting. Before leaving, we will take your child on a short walk to make sure he isn't too dizzy and that his belly feels okay. Your nurse will give you instructions on how to care for him at home. The IV will be removed, he will get dressed, have his temperature and heart rate checked one last time, and get a wheelchair ride to the car. Remember, anesthesia can make him feel sleepy and dizzy, so he will need to take it easy at home.
We thank you for choosing our health system and look forward to continuing to care for you and your family in the future. Please take a few minutes to complete a survey card while you are here to help us evaluate our performance and meet your expectations. We will also make a follow-up phone call to seek your feedback regarding your care. The Lancaster General Health Team is committed to caring for the children in the community and are dedicated to making this a personalized experience.